Mr. President, dear colleagues, good afternoon. Prospective randomized control study to assess the effect of perineal bleeding cleansing with covidine iodine before transrectal needle biopsy of the prostate on infectious complications. Between 1st of July 2013 and 5th January 2014, transrectal needle biopsy of the prostate done to 120 consecutive patients. The indication for biopsy in these patients were PSA more than 2.5 nanogram per ml or abnormal digital rectal examination. Prospectively randomized into two groups, perineal cleansing group with covidine iodine, 60 patients, and no cleansing with 60 patients. Same prophylaxis scheme for all patients applied, which was 3 gram fosfomycin per oral the day before and 1 gram amikacin IV infusion 30 minutes before the procedure. The primary endpoint was to assess the infectious complications. The parameters assessed in this study was patient characteristics, comorbidities, total PSA, free total PSA ratio, total prostate and transitional zone volume, PSA density and transitional zone PSA density, history of previous use of antibiotics in the last 3 months, previous transrectal needle biopsy of the prostate, hematuria, hematospermia, rectal bleeding, and pathological results. Only mean prostate volume was larger in covidine iodine group with p-value 0.016. Infectious complications were observed in 4 patients, which account 3.3%, 1 patient which account 1.7% in covidine iodine group, 3 patients which account 5% in control group. Regarding infectious complications, there were no significant differences between two groups in terms of all parameters. In conclusion, although the perineal cleansing with covidine iodine decreasing the trend of the infectious complications curve, but it is, in our study was statistically not significant. And we need for more studies with more number of patients to prove that. Thank you.
So, starting with the methodology, does it mean that your power calculation was not strong enough? And having said that you increase the number of cases, but if you do that, you will reach statistical significance. But does it then have clinical significance?
There was just 1 patient of 60 patients in first arm, which was we applied the covidine iodine, and only 3 patients in the other arm where we didn't use the covidine iodine for cleansing of the perineum.
So for the power calculation, did you think that 10% less infections or 20%? What was your power calculation here?
Really, we considered it as the number of the patients. We considered the primary cause that it was not statistically not significant.
Okay. Question?
Jay Roman from Hershey, Pennsylvania. I think the power calculation is a good point. We have a very similar study accruing, and our power calculation was you need about 250 patients total, 125 in each arm. And that was stratifying both by outpatient urinary tract infections as well as hospital admissions for sepsis. Our data has also shown a trend towards improvement. We've actually looked at blood cultures and urine cultures after a biopsy and have found statistically significant reductions in bacteriuria and bacteremia. So I think this is just a function of you need to accrue enough patients, but I do think it's going to be not only statistically, but probably clinically significant.
Thanks so much. Our study is continuing now, and we are now doing the urine culture and blood culture just for those patients who are infected. And also we are going to the culture for the perineal, from the perineal region to assess the microorganism resistance.
There is some literature in the penile prosthesis literature where the investigators make a big point about a scrub 10 minutes by the clock, namely suggesting that the duration of the prep has an impact. One, do you have any evidence that a longer prep is better? And number 2, did you do a swab of the perineum after the prep to see if it was culture negative?
Really, we didn't do it after application of the covidine iodine, but we did it before application of the covidine iodine, and but we didn't do it after.
And I think it'd be worthwhile to answer the question to see what the residual time is. Yep.
So we've done 98% reduction in microorganism colony counts before versus after. We hold for 3 minutes.
Thank you very much.
Thank you.